My name's Garric Vosloo. This is Functional Medicine Fast Track, and today I want to chat to you a little bit about integrating functional medicine the right way. And there is a wrong way and there's a right way. And we've gone through the University of Hard Knocks along the years and realized what doesn't work. And there are many elements to integrating functional medicine the right way. And if you get it wrong, it's going to be very frustrating, and that kind of frustration that's been building up with not getting patient outcomes over the years is going to stay there. And we don't want that for you. We want to fast track you into the right way of doing it. So as I mentioned, there's many different ways that encompass the right way, but today I want to speak about one specific way. And I want to ask you, do you do consult to consult, treatment to treatment type of paradigm or models with your current patients? Because what we have found with functional medicine, if you're doing that consult to consult model, it is very ineffective. And that, again, it just brings that frustration out when we had to experience that ourselves and realize that there was 80% of the patients that were starting with functional medicine never got a great outcome. And we had to figure that out. You know, the healthcare system is in crisis at the moment, and it's really because practitioners have to rush through appointments. They don't take the care with their patients that they really need to with those chronic patients and helping them towards optimal wellness, because those patients actually need a lot more attention than let alone a 7-minute consult, a 45-minute consult. They need more support, they need more accountability, they need more education. And really, you know, as we see this crisis just extend its head into all ugly borders of the world, and all our patients are heading in the direction of obesity, diabetes, hypertension, arthritis, high cholesterol, cardiovascular issues, all of these ICD-10 diagnoses that are going to hit them at some stage, they have those developing already. And all of those are really this big red flag to tell us as practitioners that these patients have chronic low-grade inflammation, they've got high oxidative stress, and their immune systems are becoming dysfunctional. And if we don't get to that underlying root cause, they're all going to end up with these ICD-10 labels of obesity, diabetes, hypertension, arthritis, Alzheimer's disease, whatever it may be. And then they are labeled with their diagnosis and they put into a certain box or category, and that's how they're treated with that protocol. And we know that that is just not the way of the future, and that is why there is this crisis. So do we continue to give them these band-aids until they inevitably go downhill and continue not to just give them the right personalized plan, the right education, the right support, the right accountability? Which way do you want to go? Do you want to go that monotherapy, or do you want to really do it properly? So that is really, do we need to take a fresh look at what has not worked and then realize that our paradigm needs to shift tremendously, not just in our knowledge, but the way that we look after our patients? So do we move from this consult to consult paradigm into something that is more comprehensive? Because these patients have had years of poor habits creeping up alongside their genetics that may be inefficient, and they're heading in this direction of chronic disease. And that is frustrating, not just for you, but for them too. Now, as health practitioners, you might agree that we're far better placed than the public as far as base health knowledge goes. You know, everybody thinks they're the doctor and they're going to give you great advice, but honestly, you're in the best situation. You've got your undergraduate degree, postgraduate degree, you've got experience, you've worked with patients. Like, you need to be the forerunner as far as the future of medicine goes. Don't leave it into Joe, who is getting involved with some product and giving all that education to people and they're listening, because they don't have that base understanding of a licensed practitioner. So that is really, just think about it. You know, half of our patients are actually going to Dr. Google, social media, biohacking themselves, and looking for all these little tidbits to improve their health. And why? Because us as a health profession have not helped them to get to where they really want to be, and that's better health that's sustainable. Not when is it going to recur that I need to go back to the doctor. So you see, this is really one of the biggest reasons that consult-to-consult sessions do not adequately support our patients, because they do not help a patient with multiple comorbidities to understand all the different facets and factors that are affecting them in their health. And this is why you need to be using comprehensive programs that have a base of a personalized plan and then are supported with the right education, the right support, and the right accountability. And when you get all of those factors right, then your patient will more predictably move towards a greater outcome, which is what we are hearing all practitioners want. It's just natural. That's why we're in the health profession. So why are practitioners still doing this consult-to-consult model? Well, there's really three reasons. It's stuck in our paradigm, and to change is tough. I mean, what an excuse. I mean, that's just incredible. The second reason is, yes, medical insurance and third-party interference dictate this is the way it will be. And who knows if there's a bigger plan behind them to keep people just not getting better or not. But there is this interference and this way for them to dictate the way you are supposed to work in that model if you're in the insurance model. And that's why you need to move into a cash-based practice, so you can actually decide how you want to look after your patients. And the patients are willing to do that. They're getting high deductibles now all the time. They're paying anyway. And between their direct and indirect costs with their chronic disease, it's costing them more than you can ever imagine. I mean, those stats have just come out now from Milken Institute, and it's incredible how costly chronic disease is to the patient directly, not just to the economy. And then the third reason is that practitioners are really confused on how to deliver a comprehensive program. And sure, that makes sense. I mean, it's all new. It's not something that we got our heads around in a short space of time. And there really is this lack of clarity on understanding how to actually support chronic patients and patients that want to move towards optimal wellness in the best manner. You know, times are changing, and it's only those that really want to change that are going to be popping up their ears and listening very carefully to what we're saying, because we've been going through this for more than a decade, going on 2 decades, and have had to figure this out the hard way. So really, we're just fast tracking you to this is what works. And like, if you want to get that frustration out of yourself, because we know that is the primary factor that we're seeing with most practitioners, they're just frustrated. They want to go that next level up. You need to be listening that it's not just pure information that you need to be learning. It's not just functional medicine information. You need to be learning functional medicine transformation. And transformational functional medicine programs is where it's at for the future. Not informational programs where I'm saying, what is the curriculum? How does that curriculum compare to the next curriculum? Wrong question. That's a frequently asked question in the wrong direction. We need to move to the should ask questions. And the should ask questions is, how do we really get great patient outcomes by using functional medicine information in a transformational manner that can not just change my patient's life, but can change my life as well in many different facets. And what is the best return of investment for me as I go through this path of learning functional medicine and doing it the right way, not just financially, but emotionally and mentally sound, and just knowing that I'm in the right direction and I'm fulfilling my purpose. That is the return of investment. It's not just pure numbers. So the fact is that you're listening to this, not reading this, that you're listening to this video tells me that you're seeking solutions and understanding that consult to consult is maybe not the best way. So face to face, treatment to treatment, whatever paradigm it is, let's realize that we need to change our thinking. Just as functional medicine has come our way and it is a new way of thinking, So we need to actually change our whole thinking process in how do we deliver functional medicine the right way, develop systems, develop automation, develop the ability to leverage your time so that you can actually get results. And those facets are the nuances and the detail in success in getting functional medicine done the right way. You see, the joy is that once you actually connect all these dots that I'm speaking about, that integrating functional medicine the right way alongside your existing skills in a program style method is the best solution. Your whole world can change that rapidly. It doesn't need to take you a decade to figure it out. We've done the hard work for you. We can help you through those. And what I can tell you is that your frustration can almost instantly change to joy. And that is often the best feeling in the world, when you have that aha moment and all that pressure is released and you realize, okay, I'm in the right direction. I've got the foundations right. Let me just master this and make a proper impact in the world. And let me live the balanced life that I really want to. You see, you're going to start to see happy patients that are just thanking you for being that health professional that's decided to move in a different direction, look after their patients in a different way, support them in a different way. That is all just key, you see. As the dust settles and everybody starts learning to leverage their time and balance life up between business, family, lifestyle, that is really the aha moment that we want you to realize. And just to feel and to know that you don't have to have this be trapped in the health system. Have that frustration and that anxiety and that ceiling on your income and all those limitations. There's actually a wonderful world out there that is just waiting for you. But the key is to get functional medicine into your system the right way, to deliver it the right way, to bring in not just information, as I was saying. You've got to bring it in with systems and automation and different thinking and changes in paradigm. And when you get that right, that's when things really move rapidly uphill for you. So, you know, from a functional medicine fast track team perspective, we have the skills, we have the wisdom, we have the heart to help you create the business and the lifestyle you've dreamed of. Bottom line. We're living it now. We want to help more professionals like yourself just move to that space that is just extraordinary. Our big limitation is our program is an invite-only program because we want to look after you like we look after our patients. We want to give you undivided attention and help you to that next level. And we can only invite in so many practitioners at one time. So this is why we do these videos, because we want you to get clarity on what you want in life. We want you to have a firm goal, and then we want you to realize that not every program out there is the same. You can't compare apples to apples. That's the bottom line. If you want to fast track your success, then the bottom line is the next step for you is to book a call with us so that we can help you understand what it takes to actually get functional medicine right, to integrate it with your patients into your life and just enjoy the successes and the fruits that functional medicine offers when you integrate it the right way. So this is just me rounding up now. If that all makes sense to you, you want to move forward, you know what your goal is, you want to get it done, and you don't want to go through that university of hard knocks. You don't want to try to figure things out. You want to pick the brains of people that have already done it and you want to fast track your success. Then book a call with us. Just go to www.fm-ft.com/apply and that'll go to our schedule. You can jump on a call with us. It's going to be 45 minutes long and we're going to just help you understand what it takes. We're going to put a game plan out together, how to achieve your goals, and just paint that picture of how easy it is, yet it's not simple. That's the key. And that's where mentorship and coaching fast tracks you to make it simpler than it really is. And that's the key. So my name is Garric Vosloo. This is Functional Medicine Fast Track. It's been great speaking to you, and we're so looking forward to helping you in the future to integrate functional medicine the right way. If you want to go to that booking page again, it is www.fm-ft.com/apply. That'll go to our calendar. You'll get a short form to give us some information about yourself. And then we're looking forward to seeing you. Our team are waiting here to help you to fast track your success and integrate functional medicine the right way. Until then, see you later. Bye.